Ready.
So hello, everyone. Thank you for being here with us today and watching this webinar. My name is Mikol Bach. I'm the VP of Marketing of OmniWave, and I am very excited to dive into the full capabilities of the OmniWave device, and especially focus on the enhanced calibration feature. I am here with two expert physicians and KOLs, and Dr. David Cunningham and Dr. Nathaniel Schober. Thank you so much for being here today with us.
Thanks for having us.
Yeah, thank you.
Dr. Cunningham, would you want to introduce yourself a little bit? Tell us about your practice and just the use of OmniWave within your practice.
Sure. So I'm Dr. David Cunningham. I'm a family physician, board certified, and have a specialty in regenerative medicine. Been practicing for a little over 20 years and joined the GainsWave team as a physician and then as one of the national clinical advisors about 6 years ago. And I've been using OmniWave now for a fair amount of time. Everyone knows here, it's a fairly new device on the market, but it's been exciting to add it to my practice. It replaced another focused shockwave device, and it really has made a significant impact in terms of the efficacy of the treatments that I've been providing, both sexual health as well as musculoskeletal health and healing. I have a host of things here in my office. I have electromagnetic transduction, I have deep tissue laser, radial pressure. I have a number of different modalities that I use. And without a doubt, OmniWave has taken a lead role in terms of all of my treatments, whether it be wound healing, whether it be, again, sexual health. Just as a quick note, I have a lot of guys that are coming back having been treated with other devices, either in my office or other practices, and seeing a notable improvement in the quality of their erections and the just overall treatment efficacy, even after a few treatments with OmniWave. So it's been a really nice thing to see. I have a mix of in my practice and mostly a membership-based structure for payments, which is nice. So whatever I need to do to help patients is on the table. I know the audience out there probably has a mix of things, whether it be pay-as-you-go programs, packages, memberships. So a lot of different ways to do this. I know today is more of a focus on some of the technical aspects, but it's been a great addition just in terms of overall practice growth.
Amazing. No, thank you so much. And I love that you're telling about the upgrade. I think that's super useful. And having the device on camera, we'll dive into the technicalities a little bit later on. But that was a great introduction. We appreciate that. Dr. Nathaniel Schober, tell us a little bit more about yourself and your practice.
Yeah, so I like to go by Nathaniel, and I own a practice in Concord, New Hampshire, called Greystone Regenerative Medicine. I'm a naturopathic doctor trained at Bastyr University out in Seattle, licensed here in New Hampshire, and I specialize in musculoskeletal health, joint pain, degenerative joint and degenerative diseases. I do a lot of injections in my office, everything from amniotic tissue, allografts to PRP to ozone. I utilize a laser as well. I do a lot of IVs in my clinic. And then as far as shockwave, this is actually my first shockwave device after researching them for 1 to 2 years. I had been looking at getting a device in the office, and as doctors, we all want the best in our office. We all want to practice in the best way that we can. And so I took my time with looking and really kind of combing through the research and looking at what device may serve me best. And really, I settled on the OmniWave purely because of the anecdotal evidence from other doctors and what they were seeing in practice. So I jumped on board pretty soon after a few doctors talked to me about having the OmniWave, and I can unequivocally say that since adding the OmniWave into my treatment plans, it has certainly accelerated the treatments and the outcomes of my treatments. You know, medicine is tough at times, and we all struggle at times with some medical failures in cases. The the great thing about the OmniWave is you always have a tool there to offer to the patients, and you know you're not going to do harm. You're only going to help potentiate and help with the regeneration of tissue. So,
Amazing.
yeah.
No, for sure. And so, Dr. Schober, as we're already talking to you, tell us a little bit more about how you use the machine, what specifically you use it for, and then let's dive into the technicalities of how it works.
Yeah, so I use the OmniWave in conjunction with injections mostly. So
Mhm.
if I do a joint injection or a tendinopathy or a tendon injection, or if I'm treating a ligamentous issue, um, I'll always shockwave before I place the biologic or the growth factors into the area. And this comes from the idea that with the shock wave, we're sort of, as the energy propagates through the tissue and strikes the tissue, it stimulates their own endogenous releasing of growth factors. So in a way, we're kind of, I like to think of it as tilling the soil in a lot of ways. And then we go in and we can plant these seeds, so to speak, whether they be mesenchymal stem cells or bone marrow aspirate or PRP, and then they're kind of going into this somewhat of a live environment, and the action of the growth factors uh, really accelerates. So I use it in that case, and then I also use it purely, many cases an injection isn't really called for, and it's a tendinitis, and shockwave and laser is plenty in a lot of cases to help alleviate the symptoms and help with growth. I like to start with, in this case, less, and then work up the intervention chain. And so shockwave is great, especially if you're not doing any injections and you don't have, it's a quick, easy treatment, and the cost benefit ratio of shockwave is really, really great. So I'll use it just as follow-up, even just as an initial treatment for all kinds of musculoskeletal issues, and in particular back issues. Injections into the back can be kind of tricky. You want to be really skilled and precise with that, and if you just have an ultrasound in office, which is, I have ultrasound, that's not really good enough to get the injection where it needs to be. And so shockwave offers a really great option to treat disc pathologies and even arthritic joints in the spine, because it's going to treat the area without being as precise as using an injection. So I'll use it as follow-up. Yeah.
Amazing. Dr. Cunningham,
Sure.
same question for you as well. What are the uses? And in your case, you've seen a noticeable difference, right, between a machine that you had before and the OmniWave machine. Can you talk a little bit more about that?
Sure. So in my practice, I'm a big believer in synergy, very similar to what Nathaniel was saying in terms of doing multiple modalities. I do some biologics. It's not a huge part of my practice, something I'm looking to grow. But in my practice, I'm doing more with the EMTT, laser, and shockwave together, sometimes radial pressure. For sexual health, I use Emsella, which is a pelvic floor stimulator, plus the OmniWave. So always that little bit of synergy. And what I'm finding is that for a lot of indications, I'm getting the same benefit with just the OmniWave that I would have had to do 3 different modalities and take up a lot more time in order to get. And I think why that is that the OmniWave, because it is electrohydraulic and not electromagnetic, the rise time, and this is something that we talk about repeatedly, in terms of OmniWave differentiating it, the rise time of that shock wave is so quick. So the time is so short that our bodies almost can't feel or sense this shock that we're delivering. So we're able to deliver a much higher level of energy in a very comfortable situation, a very comfortable way. And so the experience of the patient is usually very often not feeling anything at all, or feeling a little bit of discomfort just in certain areas. Whereas with the electromagnetic device that I used to use, which is one of the sort of standards on the market, I couldn't get even half of that kind of energy without them jumping off the table or really being in discomfort. And that limits the amount of energy you can get, the concentration, the duration, the number of pulses. So by being able to get a much higher level of energy at a comfortable experience, we're getting better results much more efficiently. And again, going back to what I said before, some people do it by treatment, people do it as a package, some people do it as a membership. Understanding that this is a much more efficient way to treat somebody can change those the way you sell it, offer it, program it, package it, because they may only need 4 treatments, whereas previously they needed 6 or 8 or 12 of the other things that I did. Let me see, spine, just kind of what Nathaniel was saying. If any of you are working, I'm south of Boston. I'm between Boston and Providence, so there are tons of pain clinics, spine centers. It's a very competitive market here. More and more people have deep tissue laser, have shockwave of some sort or other, doing orthobiologics under fluoroscopy. But if you're in an area where the nearest fluoroscopically trained spine specialist is 2 hours away, this is incredible. There's no downtime. It's safe. It's non-interventional or non-invasive. Really fantastic results that we're seeing with spine. I always tell the story of a patient who had 10 years of post-herpetic neuralgia around her waist, and we've been treating it for a while and getting little results that would then slip back. And with the OMNIWave, she's really finally moving forward. And that's somebody that probably would have needed a much more advanced procedure in a tertiary care facility if she could even find one that would do it. So great opportunity for a lot of things, in a more rural area where people, don't have access to advanced image guided techniques. And as Nathaniel said, you also need a lot of training. I know a handful of people around the country who do that kind of work with PRP in the spine, and they are, they're getting people flying in from all over the place because they are sort of the best of the best with the way they do it. But we can fill in that gap between nothing and traveling.
That's amazing. That's amazing.
Yeah.
So let's dive a little bit more in the technicalities, right? We were talking about the power. How do you calibrate the power with this machine? I know, Nathaniel, you mentioned it earlier a little bit. Do you start low? How do you go? Is it different for different parts of the body? Tell me a little bit more about that. And then again, same question for you, Dr. Cunningham.
Yeah, so for doctors that are looking at shockwave, I can speak personally that when I was first looking for a shockwave device and asking doctors about radial versus focus, doctors would say, well, you kind of need both. Well, OMNIWave, really, due to the technology, eliminates the need for a radial device, and that's primarily because you can calibrate the energy for superficial. Usually you would use traditionally you'd use a radial shockwave device for more superficial structures. Just due to the nature of focused shockwave, focused energy travels deeper into the tissue, and so it gets stronger as it propagates through the tissue, and then it falls off. So you have this treatment zone that you need to kind of get your deeper structures in, but again, due to the technology, you're able to calibrate it so you can very effectively treat superficial structures, and the energy is so much greater in a focus than it is in a radial. I'll tab a fantastic PubMed article that really outlines and talks about the science really in great detail. It's a PubMed article on shockwave and the differences between radial and focused shockwave. But just to quote that article, they say, focused shockwave therapy features the generation of a pressure field that converges in the adjustable focus at determined depths in specific tissues where maximal pressure is achieved. So in other words, these focus waves, they travel deeper into the tissue than radial waves, and they have a more profound effect. So our goal as doctors is to really get the tissue structure in that treatment zone. And we kind of do that by adjusting the fluid in the Omni handpiece to account for this. Yeah, so there's a lot that goes into the science and technology in shockwave, but just know that focused, I think, at this day and age is a more optimal way to go than a radial. And as you get more energy into the tissue, which is what you want. So I start at the maximal power, which is 12 on the OmniWave device. What you want to do is you want to get the most energy into the tissue that the patient is most comfortable with. So I start off high. If they can tolerate it, I keep it there. I've had patients where that it would be too much, and then I would sort of go down from there. I know Dr. Cunningham starts off low and works his way up, and either way is fine. I think that the goal is to get the most optimal energy into the tissue while maintaining a level of comfort for the patient. So the highest point of tolerance. So I start off at 12, frequency at 4, and I do a minimum of 1,000 shocks per treatment site. So, and then you can go all the way up to 1,500, and then you treat, again, this is more nitty gritty, but multiple sites at that structure.
Amazing. Thank you so much. And Dr. Cunningham, as Nathaniel and Dr. Schober mentioned, your approach is slightly different. You start lower and go up. Tell me a little bit more about that. And I see that your partner has joined. Linda, is that correct?
Yes, Lynn.
Welcome. Thank you so much for being here and assisting us today in this demonstration. So Dr. Cunningham, if you want to answer that, and then I guess we can go even more in depth into the technical calibration of the device.
Sure. As you were mentioning, I start a little bit lower. I don't start all the way down at the very lower ends because I don't find that we're getting much benefit unless we're doing certain like, sexual health or really sensitive structures. But for most of the things, especially all the MSK work, I start around 8 or 10 and then go as quickly as I can up to 12 to get to that maximum power level. Like Nathaniel said, it's really important to get that energy in. And because of that, I think we're finding that it's so much more efficient. I've had so many instances where somebody had come in previously for a treatment with my other device, and now they're back maybe for a touch-up or maybe because the same issue has flared up. And I'm amazed at how much more energy they can tolerate with the OmniWave. Again, electrohydraulic being very different in the way it creates shock waves from electromagnetic, much more tolerable at much higher levels. And as Nathaniel said, it's a fixed distance. So I was going to, I know there are diagrams out there. I think there's actually one on our OmniWave site. It shows that focused shockwave is a focused beam, almost like I've always described it as a cigar shape of energy. And that is fixed at a set distance from the applicator, from the handpiece. But by using what we're called the OmniFlex, which is that the bellows that we can adjust with water, we can adjust how deep we penetrate that energy, or where you can target that maximum amount of energy, sort of the fatter part of that cigar shape that we get. So I don't know if you want me to demonstrate.
I would love for you to show exactly what we're mentioning right now. We've spoken about it, but I'd love for you to demonstrate and just showcase the machine and the retractable bellowing head. And then I know Dr. Schober is already prepped with the saline water so that you can demonstrate how that can be modified. Or
yeah,
but
definitely.
it would be great to just kind of understand what this calibration is, where it comes from, and this incredible feature that I believe is unique to us and that makes the big difference for depth and versus surface level.
Sure. So as I was saying earlier, the depth of energy is a fixed distance from the applicator itself.
Yep.
And so by adjusting the amount of fluid, and Nathaniel will show you how we do that in a moment, but by adjusting that, we can adjust how deep we're getting that energy. You can adjust the power very easily here, and within reason, it's actually, you're able to adjust the frequency separate, independent of the power. And I say within reason because if you go up to some of those higher powers, like especially up to 12, it does max out at 4. But even that is fantastic. In my older device, I think at the maximum energy, we were probably around a frequency of 2 or so. So this is literally twice as efficient in terms of the duration of treatment. You're going to have half the time, and then you can adjust the number of shocks here. And what I often do, is I'll start at 8 and 8, or 8 and 9 on the frequency, and then quickly go up to 10, and then up to 12. And you can see the frequency auto adjusts, once you get higher than 8. And as we mentioned, so depending on how deep we want to penetrate the energy, or where we want to maximize the energy, we can change the bellows here. I'm not going to go ahead and do that right now. I'll have Nathaniel show us how to do that. But if we were going to treat Lynn's wrist, so Lynn is a master esthetician and does a lot of treatments with our patients where it's actually fairly demanding on her body, and sometimes we treat her wrist with this device. And so if we're going to do a localized treatment and a very superficial treatment, say on the tendons of the hand and wrist, we want the most superficial energy production or targeting. So we're going to push the OmniFlex bellows all the way out as much as we can, because we want that energy to be as close to the end of the OmniFlex. So we'll treat in different areas around the hand and wrist. And one thing I always like to teach is once you have to make good contact. So we use an ultrasound gel, but once you have made contact, you can actually just very gently alter the angle. Because of the way that the energy propagates, sort of in this, again, almost like a cigar shape, imagine a very stretched oval. There's a targeting effect. It's not quite like a laser pointer, because the beautiful thing about the OmniWave is it's a much larger treatment zone than any of the other focused devices on the market. So you're going to get a wide spread, but there still is a difference in terms of that maximal energy. So, you may be here and somebody's feeling it, and then you kind of just a slight angle and they
Really feel it.
They really feel it. Exactly.
Hurts.
Yeah. So you can get those subtleties by doing that. Now, if we were treating Lynn's, if we had her ankle or her elbow, and again, we would treat right on the skin, obviously, that's sort of more of a small to medium-sized joint. And so we're going to bring that bellows down a little bit because we want to get a little bit deeper. And again, I would treat, using different angles, but I would also treat in different areas. And sometimes even if you have, say, like lateral or medial epicondylitis, we're going to treat slowly. After treating the focused area, I might treat slowly down those muscles, either the extensor or the flexor muscles, depending on what's involved. So it's a really nice feature. And as Nathaniel said earlier, a lot of people would say you need a focus and a radial device. With this, because you can modify the depth so precisely, you can get into those muscle tissues all the way up and down, where I would have used either the laser or the radial in the past. For shoulder, sort of a medium to large, depending on the person, we're going to, again, probably keep it at that medium level of the bellows. And I usually on the shoulder will treat in 3 different areas. I'll treat posteriorly, again, changing the angle a little bit. I'll treat anteriorly, especially if you have somebody with bicep tendonitis or AC joint issues. And then often laterally, especially for those individuals with deltoid pathology. And then if we get to the hip or the knee, some of the larger joints, we're going to bring that all the way back, because we want to get the greatest depth. And this is really important. So it almost seems a little counterintuitive. The deeper you want to go into the tissue, the more shallow you need that bellow, and the closer you're going to get to the body with the source of energy. So if you think about that, then it makes sense. And again, the same thing with the hip. The hip is a pretty large joint. So a lot of times I'm going to go anteriorly, I'm going to go laterally. I might even go posteriorly if there's, posterior pathology, sometimes associated with even SI joint stuff. So as Nathaniel was saying, along the spine issues. And then finally the knee, which is one that I do quite a bit of. I'll do, as Nathaniel said, he usually does 1,000 shocks. I might back it down a little bit and do 750 to 1,000 on the lateral aspect, the medial aspect of the joint line, and then anteriorly. And as I mentioned before, once you have made contact, you don't want to be, it's not a radial device. So if anyone's used a radial device and they're constantly moving that radial device, this is very, very different. You really want to maintain that contact in one area and just slowly move it if you're not in the right spot, and angle in different ways. And you're going to get different tissue targeted by doing that. Same thing anteriorly and same thing medially, just kind of going along that joint line. You're going to get a lot of the interior structures by doing that, because, depending on the individual and how large their knee is, you're going to be able to angle that targeted energy. And I would probably, again, maybe 750 to 1,000 in each area, depending on what's going on and how much else maybe you're doing that day. Obviously, you want to be efficient and give them the best treatment. Can't keep them there all day. So,
Of course.
and
Dr. Cunningham, you mentioned you also do sexual wellness. Just a quick
Yes.
mention. What about the depth and strength in that case?
Great question. It's definitely more shallow. So if you think about where we're treating the corpus cavernosa, treating the crura, and treating the perineum. Now, in a perfect world, I would probably go a little deeper when I'm treating the perineum. I don't find it makes a huge difference in that regard, in terms of adjusting. And for efficiency's sake, especially when I'm all gloved up and have gel and doing an ED treatment, I don't personally change the depth. And I keep it to almost the most superficial, maybe a little bit back from there, because again, I'm treating the corpus cavernosa, 1,000 shocks on either side, the crura on either side, and then the perineum. And if anyone out there is doing the treatments, I start at 8 on this device, and I'm getting really good results with no discomfort. And as you're holding the penis and treating the corpus cavernosa, you can often feel the energy in your hand that's holding. So that the energy is going all the way through, and it's a really, really effective way to get energy throughout the entire tissue.
Amazing. Do you treat also like women for sexual wellness? And is there a difference in that?
Yes, so I do treat women. We don't have as many doing FemiWave as we do having GainsWave, just the nature of my practice. But I did create some protocols based on the literature around focus shockwave for dyspareunia, provoked vulvodynia, and just overall female sexual dysfunction and incontinence. And there I do actually change the depth a little bit, because I'm treating over the suprapubic area first, treating bladder dysfunction, interstitial cystitis aspects, and irritable bladder syndrome, which really has a lot to, it's a big portion of female sexual, the concept of female sexual dysfunction, or the whole, the whole condition of female sexual dysfunction. And then I'll treat around the clitoris and the labia majora minora, and then the perineum. So I'll kind of move down. And I will adjust the depths in that regard, because again, the bladder being a bit deeper structure than the rest. So
Amazing. Thank you.
Sure.
Dr. Schober, if you want to showcase a little bit how that retractable bellow works and how we can actually adjust it, and how you find it the best way to adjust this feature.
Yeah, Dr. Cunningham, that was great. Yeah, I mean, he said it perfectly and all that. I echo all of that. So, I just, for simplicity, I've detached the head from the handpiece here. So here's the electrode coming out, and this is just the head with the bellows down here. So what I do is, when you get your OmniWave device, they send a bottle of 5%, 0.5% normal saline. Don't mix it yourself. I asked them about that, and you should get their proprietary normal saline, just so you know that the technology is going to work. And then, because I go through so much, and when I reorder, I save one of the empty bottles, and I just keep it on my workbench next to the patient. So I'll have one with sort of the clean, fresh normal saline, and then one that's empty that I'll switch out the water with. And as the electrode is used, it oxidizes, so it changes the color of the normal saline. So it'll have a slight tinge to it. But
But that's not a problem, right? You can reuse the water
Yeah.
even if you have a slight change, correct?
Yeah,
Like
yeah.
that
I'll
now we
just
don't have
go
to use it anymore.
totally, yeah. So the one electrode for the life of the electrode, I'll just use um the water interchange, the water that's been originally put in. When I do change the electrode, I'll put a new round of fresh, clean water in just to start
Mhm.
fresh.
Okay.
But as I'm using the electrode, I'll swap out whatever water's in there and I'll pull it. So you have sort of a little access point to the water here on the side. And I think Jeremy goes over with it when you get the OmniWave device, but you just click it into that side and I did have an issue where for some reason it wasn't clicking or whatever. I don't know the rebound in there, the spring in there, but it works. Eventually, some saline can the salt from the saline can kind of build up, and you have to like blow on it or something. But it'll eventually clip in there, and then you just sort of pull back on the syringe that they provide, and you're able to add water. So I don't know if you can see. So you're able to add water and the bellow kind of inflates here, increases, and then you can take away water um, as you need, depending on the tissue structure. I don't know if you can see that, but
Mhm.
so the way I do it is um, it comes with a cup here, and it's delineated with some numerical values on there. I think that has to do with how much saline is in the actual head. But there's a 40, 30, 20, and 10. Place it on the counter in front of me, and those are sort of my gauges as to how deep or shallow I want to calibrate the head to, the OmniFlex to. So the 40 is superficial, so very superficial. So between 40 and 30 is going to be your more sorry, I said superficial. 40 and 30 is going to be more your depth, your deeper tissue structures. Between 20 and 30 are more of your middle to superficial, and then down all the way down to 10 is really superficial. So that's how you'll sort of line up the head with those numbers. So as the cup is sitting on your workbench or your station, you can see the bottom, very bottom of the bellow line up with these numbers. And
Mhm.
so what you're looking for is the bottom of the bellow to line up with the appropriate number for the depth. So if you're treating, for example, a knee, I'll have it at, probably 30 to 35
Mhm.
ish. And what I'll do is I'll actually um, put in more water. I'll overfill it,
Mhm.
and then I'll draw down to the depth or the number that I want to get to. And what this does is it ensures that you don't have any air bubbles. It helps to eliminate the air bubbles inside. So it's almost unavoidable when you add in water to the OmniFlex, you're going to get an air bubble in there from the syringe. So that air bubble is going to make the electrode less efficient in producing its spark. So you want to eliminate that air, and sometimes you'll know that you have air in there if every once in a while the OmniWave will like do this big pop and it'll like light up, and that's sort of an indication that you have too much air in there. So by adjusting the head, you want to do this, it helps make sure that your energy production is consistent and efficient. So I always overinflate it, and then I'll pull back to the level that I want to get to. So in this case, if I'm treating a knee, I'm going to go to about 35 or so. And then
Mhm.
you can kind of see there's some air in there that I pulled out from
Mhm.
the head. And that's how I do it. And then you just unclip the disconnect the um, adapter or the tube, the male part from the female part on the head, and then you're ready to go.
Amazing.
So yeah.
That's
Just
great.
a quick note, I had the same issue at one point, getting the syringe head to, or the
Mhm.
hose head to click in. And I think you're right. I think it was just a little bit of buildup of the saline, a little bit of salt. I just squirted a small amount and it was gone immediately. So if anybody out there has that experience where it doesn't feel like it's positively clicking in and locking, it may just be, sort of unavoidable, a little bit of the salt buildup because it's the, fairly high concentration saline solution. So just
Oh.
squirt it, done.
Dr. Cunningham, anything that you'd like to add on top of what Dr. Schober did in his demonstration? I think it was very, very clear, but anything that you'd like to add on top of that?
No, I think it's a great way to be able to adjust, on the fly very quickly. I know that we're working on a different type of holder that's going to have, sort of level 1, 2, and 3 coming, make it a little bit simpler for everybody out there using it to know where they are. I will say that it's far simpler than switching out standoffs with my other device and always having to make sure that they're clicked on properly and trying to figure out which standoff I'm using for what. Yeah. And Lynn has a lot of experience using this as well, and as well as using the prior device too. And I think we would both agree that this is much simpler in that regard.
Amazing.
And don't forget, you're going to get energy, impacting tissue regardless of what depth you use. This is really in some way fine tuning it for the absolute best experience. But even if you forget and somebody walks out and you say, I didn't adjust and I was treating an elbow and then or treating their wrist and then their knee and I forgot to adjust,
It will still work.
Yes, that's one of the beautiful things about the OmniWave, I think, is the lack of discomfort because of the high rise time and the larger treatment zone. You're going to get benefit regardless. It's I don't say foolproof, but it's almost foolproof. People will benefit regardless of how you make those adjustments. So we're just trying to hone
it
down.
Works either or, but we're going in to understand just the technicalities of it.
100%.
I think we have reached the end of our demonstration, and I'd just like to ask if you have any last advice or tips for the doctors and providers out there, maybe the ones that are just starting off, anything that you want to tell them, let them know from a technical standpoint, but just also in general from a practice standpoint that comes to mind. We can go Dr. Schober first and then Dr. Cunningham.
Yeah, so I'm a do-it-yourself kind of person. I like to make repairs at home. I like to build stuff. And there's tools that we have that from being a novice builder, I always struggled with getting my cuts right, like the angles and the just so that things kind of fit perfectly. And there's this tool called the square that gives you the angle that helps you get your cuts and your measurements right. And I never knew how to use a square until I learned how to use a square. Then my cuts became much better. Just transferring that idea to the OmniWave, we have a really great device here that if you know how to calibrate and just get past the initial feelings of if it's cumbersome or not, get past that and just realize that you have a really powerful tool that's unlike any other shockwave out there, in that you can adjust. And so your outcomes are going to be so much better because you have a tool. And if you know how to use the tool and calibrate it and just, again, get past that initial, I got to mess with the water and syringe, get past all that and just know that you're going to be you're going to get better results. One other little kind of pro tip is that you may lose track of the counter as you're giving treatments. As you calibrate the head, I noticed that the energy stays pretty consistent even when you get into the 10,000 range. But if you're in the middle of a treatment or you're treating multiple sites and the counter zeroes out, it won't let you resume a treatment without resetting the count number on it. So just a little pro tip: instead of having to switch out the electrode right there in front of the patient and get it all right, if you just go into the password setting and reset the counter, it'll restart, and then you're still getting the energy. And then after the patient leaves, then change out the electrode. So you're not fumbling with it right in the middle of the patient and taking up time. Just a little pro tip, you can bypass that initial counter when it stops and it'll stop the machine. You can get past that. So just
That's a great tip. I think some doctors might panic at that point,
Yeah,
and
right.
it's to know that it still works and
Yeah.
there's a way to fix it and not have the patient
Yeah.
be right in front of you and seem potentially unprofessional. So
Yeah.
thanks for sharing that. It's good to know, right? And Dr. Cunningham, any last words, let's say, on your end, or Lynn, please, as well.
Well, I'll just say, first of all, where were you 2 weeks ago when I had that happen? No, you did tell me that, and from, now going forward, I'll be able to do that, which it was, let's say, a little awkward to switch things around in the middle of a treatment. I would say my pearl is more is more. I used to fight a little bit against that with my other device, but more is more. Higher energy levels seem to be really, really effective. I'm sure there are still going to be patients out there where having the 2 or the 4 or the 6 on the power level is going to be, useful. And we may find going down the line that certain structures and tissue may respond even better at lower energy levels. But so far, my experience has been much like Nathaniel's. Push to 12 if you can. They're going to get the best, most efficient experience. For sexual health, I back it down, but only because that's been the way I've always done it. But still quite a bit higher, even in the sexual health than previously. And I'm getting really, really good responses much more quickly, efficiently than I did previously. So any thoughts about your experience, Lynn?
I don't have many thoughts about it. I've only used it a few times, but the one patient I have used it on, better response than the prior device. She's had pain for about 10 years.
Wow.
And since using the OMNIWave, it's improved dramatically. So,
and this was a patient we used the older device on. And so we were able to get an apples to apples comparison, which is really exciting to see, not just for her benefit, but for our understanding of the power of this device.
Amazing. Amazing. Then thank you. Oh, yes.
Yeah, sorry, if I can just dovetail on that. I had the benefit of this is my first shockwave device. There's a lot of doctors out there that may be looking to add to their practice or update, and they may have treated, like Dr. Cunningham, they've treated patients with previous devices and patients. And so you're switching technology sort of in the middle of your patient population. And, patients are not going to feel the treatment nearly as much as other shockwave devices. So this is kind of a sticking point with a lot of doctors and patients. Oh, they're not feeling the treatment. I don't know if it's working. It's working. It's totally working. Get past the idea that that they're
pain,
not
no
feeling
gain.
it, and that's part of the technologies. And one way to talk about it with your patients is, our technology has improved to where we can get even better results without you being in pain. And that's just one way to say it. So I just wanted to put that out there as well.
Amazing. Thank you. So Dr. Schober, Dr. Cunningham, Lynn, thank you so much for this webinar, the great insight that you've given, also on the technicalities, but just on your experience, on your practice. I think this is going to be extremely useful to all of our providers out there. For all the providers, this webinar will be on School. We will push it there. We'll share it on by email as well. And I believe Dr. Schober, Dr. Cunningham, if anyone has a question, they can reach out, and on School, you'll be able to answer as well. And if needed, potentially we can put them in contact with you. Is that correct?
Yes, perfect. Definitely, if you can put it on School, because if you have a question, it's very likely that somebody else out there has the same question, and we can share ideas and best practices and solutions.
Yeah, I think, as you mentioned, like sometimes the question can be the same, and we're trying to build this community out there. We're trying to help each other. We're trying to help build practices, improve practices, and obviously improve patient outcomes. So if you can share that out there, then it's even better. Thank you so much, and let's have a great rest of the day.
Sounds
Thank
good.
you.
Take care, guys.
Thank you.